before the license and the applicant even comes before the Board of License Commissioners, we prepare them as much as possible. We do invention work, we do risk and protective factor management. So if a business will say to us, well, I have a bunch of 18-year-olds that want to bartend and work in the business, we'll say, well, that's not against the law, but you're putting yourself at risk. Let's talk about how you can train them better, or how maybe you can hire somebody a little older. These are all little things, little nuances that we talk with businesses about when they get ready to open their business. Sometimes a business that doesn't sell that much alcohol, and they said, oh, well, we're not at risk at all because we don't sell that much alcohol. They're the highest risk for sale to minors because they don't have the correct policies in place. So we really spend a little more time on those businesses. Is it really worth them to have alcohol? Sometimes it's not. That $1,000 fine for the first offense might not be equal to the amount of alcohol they sell. So they really have to weigh those risk and protective factors. We have what's called an ART team. It's an application review team. We meet weekly. We get in contact with the person that the applicants for that license, really talk it through with them. I love all these acronyms. We have an EAT team, and that is early assistance team that we work with the comptroller's office as well. We bring them down here to Montgomery County. We meet with people who want to open a brewery or go in business in the county and also have a state license, or people that already have a license. We have several businesses right now that want to start making their own beer. So we're making it happen for them. So they're already in the county, they just want to make it better. So we're all for that, and we just want to help make them do it right so they don't go to the wrong agencies and have to pay more money for something they wouldn't have had to pay more money for, and just help them along. Our alert training is something that we created. It's alcohol law education and regulatory training. It really does help to mirror the state training. The state server training can cost anywhere from $50 to $100 per person, and in Maryland there has to be somebody that has that training that's in the business. In Montgomery County there has to be somebody on duty at all times with that training, and they do get checked for that training. We encourage people to train their whole staff, but it does get expensive at times, and it's not a priority. It's once every 4 years. That's what I did for 16 years, and I hated it when people would come in and say, this is the third time I've taken it, that's 12 years, and then they go, oh, you mean I can do that? And it's like, yeah, well, you didn't listen 12 years ago, So we created a training that complements that training. It's free. We've trained over 10,000 people in this alert training. It tells you what you can do in Montgomery County. It explains the state laws. It explains the local rules and regulations. People can create their own policy for their business out of that training. We have tons of resources for people when they come. We do it in the community as well, so we go out to the community. We have it in different languages. So we're very excited about the alert training. It's become a national model, and I think that as far as people being before the board for their license and being qualified, the difference in the higher standards of business, the knowledge the businesses have because of alert training has really helped. It's also identified by the board as part of a penalty. So everybody has to go to alert as well if they have any type of violation in the county. So they can take it 5 times a year if they want and get from it what they need. Builds the relationship, so it's a really great training. We also have a Regional Safety Alliance, which is another model from the Responsible Hospitality Institute. We work with police. We had a meeting in September. We have another one coming up at the end of April, where it's police from the county, from Washington, D.C., from Arlington, Virginia, our municipalities, all kinds of enforcement agencies, and people that work in other agencies that talk and discuss some issues that we're having alcohol related. Some of the legislation work we've done as a result of these meetings, especially when we work with businesses, the Nighttime Economy Task Force recommended us expanding hours for alcohol sales. We did that immediately. We also created a Class D beer, wine, liquor license, which has less of a ratio and no ratio after 9 o'clock at night. And we also loosened our ratios from food to alcohol, from 50-50 to 60-40. In the meantime, we've also created many limited licenses in the county. We have in the state of Maryland, if you sell a product, you cannot give complimentary alcohol. So we had hair salons, art galleries, everybody coming to us saying everybody wants to give away alcohol. So we created limited licenses, and they have to really go through what everybody else has to go through for an annual license. They have to be trained. The salons can give away 1 complimentary glass of wine. It's actually written as 5 ounces in the law, but it's a $100 license, and it's only till 7 o'clock at night. That's very limited. So we've created all these licenses for people to actually be more accountable. So it's accountability through licensing. And then also we work with the festivals. Sorry, that was a heavy slide. Lots of stuff. So with our festivals, we have one-day licenses, over 1,000 as well, are licensed in Montgomery County. That is where we really do our intervention work. We have staff that's dedicated to one-day events. I would say 10 years ago, it's probably been 10 years. How did we stay the same age, Tom? I don't know. But 10 years ago, we had several events that went bad. They were one-day events. People came in and said that they were working with a nonprofit, raising money for this nonprofit, and then just brought in tons of people, and there was no plan, and it was just, there was a lot of problems. And so we met with the police and with the county executive's office at the time, and made some rulings. We decided that we have this process to where if there's any events over 300 people, outdoor events as well, we work with the police, make sure there's a proper security plan. There has to be an alcohol plan with every one-day event in Montgomery County. So even if you're doing a small event in your house of worship or church or whatever it may be, which is a lot of the events in Montgomery County, and usually they get the person that knows most about alcohol to run the bar. So we won't go any further than that, but so we really do community trainings as well to work with these local folks, because they put people at risk when they're drinking and they're giving away drinks, and it's a gala and it's fun, and so these are some of the issues we've been dealing with. One thing I will say about the performing arts, we created a new performing arts license. It's awesome. Viz Arts has that, is the first to get that license. Black Rock just applied, and Kentland's Mansion has the license as well. At Viz Arts, they were receiving so many one-day event licenses a year, it came to over $7,000 2 years ago. It was a crazy amount of money. So I called them and I said, you might want to think about an annual license. And they're like, no, we don't deal with alcohol. I'm like, yes, you do, $7,000 worth. And it was just like a bottle of wine with mud and Merlot, or, painting with wine, or things like those classes. But we wanted them to start taking, being accountable and realize how you work this and the laws, and understand what you can do to help keep those events safe. And they also had the rooftop. So we created a performing arts license. They're doing great. It's wonderful. They use liquor control. We deliver alcohol to them, and it's worked very well. We have a wine festival license and a beer festival license. We're finally having a wine festival at the fairgrounds in October. Just met with them last week, and we have several town center festivals going on. They're thriving. More and more are coming. King Farms had an annual festival every year. It's really exciting. Now they want to do wine and beer, so that's next year. We'll talk about that. So these are all our partners. Just to let you know, give you a snapshot, we can't do it alone. And as David was saying, we can't do any of this alone. It's not effective if we do it alone. We have to all be talking, using the same language, and working together on this. I'm not going to go through it all. And then some of our programs, Cops and Shops is important. Our programs are important. The Cops and Shops program, we do a lot of work in Tacoma Park with the police there. We do, we write the grant funding. We write for that money. This year we have over $100,000 of grant funding and awards given to us through the National Alcohol Beverage Control Association, through state highway funds. We write, as a grant writer for HHS for many years, I learned some of the tricks. But it's sometimes tedious, but we also get a lot of in-kind resources for the businesses from industry. We do roll call trainings for the police so that they can learn about the administrative violations, so we're both on the same page as well. We go out into the community and do security and ID trainings and the alert. So you each have a packet with lots of stuff in it, and some of that stuff, the calendars I think are the most fun thing. We've done the calendars for, I think this is our 7th year. They cost about $8,000 a year. They've always been funded through source, either industry, this is state highway this year, that we worked with. So we send them to every business at renewal time so they can see when all the board hearings occur. The top 10 violations are in there. Like they'll talk about outdoor cafes in the spring, gambling issues during, Final Four kinds of things and stuff like that. So we want to educate people about, ways to be proactive. And so you have lots of treats in there, and I just want you all to take a look at those when you get a chance. The inspectors do 5 different types of inspections. They're self-explanatory. These are more like the routine inspections or an inspection when a person opens their business and really they have a one-on-one moment with the licensees. But I want to get into the next inspection, which is the compliance check. So the compliance checks is really what we're talking about a lot here as well. All those things that I talked about earlier come down to this kind of thing. You want to make sure that the people are not selling or serving to anyone under the age of 21 or anyone who appears to be intoxicated. Anyone who's a known habitual drunkard in the community as well. If you know about it, you're not supposed to sell or serve to them. So we again have lots of partners. We have team members, and I'm going to let Lee talk about that in 1 second. I just want to give you a snapshot of the different types of compliance checks that we do, the most being the sales, under 21 sales. You can go to the next one. So this is through County Stat.
Are we getting close here?
Yeah, sorry. This is only a part of what we do, so I'll be glad to come back and talk for 3 hours if you like. And no, I'm just kidding. Well, not, no. But we do a lot of things, so I wanted to be able to show you some of this. So this is the compliance check results in the last few years. As you can see, we did a snapshot when we first started this new program. The program, our compliance checks, the protocols are so strong that our show cause hearings that were mostly sale to minor show cause hearings have gone from 60% of the hearings to 5% of the hearings. People calling and they apologize. They're embarrassed. We don't want them to be embarrassed. We just don't. We want to help them. It's just usually somebody making a bad choice at that moment. So we really want to help them it not happen again. We also took our program that's very strong. The BLC and the police used to do compliance checks separately. We work as a team. We do everyone exactly the same. We took the protocols that the police were using years ago. We looked at NLLEA's protocols. We also looked at the 2002 OLO report, and that's where we got a lot of our information from back when I did this to begin with, and it still has some really, really good sound information that's valuable today for these conversations. So as you can see, we're at 81%, and the next thing is the mystery shops, which we are, through grant funding, we're working with the Responsible Retailing Forum with a third-party mystery shopper. We go to the businesses that want to be part of this program. In Bethesda, FY13, their compliance checks were at 72%, which was not that great. So we wanted to help. We've always looked for incentives, like how can we make this work? How can we make those compliance checks higher? So we worked with Responsible Retailing Forum and through a little grant funding, and the rates, we found the incentive, by the way, it was $100. So we sent messages out to the businesses. If they actually said to that person, I think you're this mystery shopper, they would get $100. So as you can see, the pass rates went from 89 and 98% from 72%. It was quite exciting. It was a snapshot, but it was exciting, so we're doing a larger program this year with grant funding. And that's it. But I do want Lee just to mention really quick about the compliance checks because
I like really quick too. Thank you very much.
Sorry.
Okay, I'll be as quick as possible. My name is Lee Williams. I coordinate the underage compliance program for the DLC for underage alcohol and also underage tobacco. One thing that we should all remember is that underage people find various ways and sources of alcohol. Our main goal is to make sure our licensees are not one of those sources. So we do these compliance checks. We do 400 per year. As Mr. Griffith said, we currently have a little over 1,000 licenses. They are done by police district. So far this year we have, as Ms. Durbin said, 81%, which is outstanding. As a breakdown, it translates into 66 locations that sold or served our underage person. 22 of them check the ID. When our youth go in, they use their actual Maryland-issued driver's license or ID card. Some of them still do not drive. But they use their own identification. They cannot lie about their age. They cannot beg the server to sell to them. It's pretty cut and dry. It either happened or it did not happen.
These are underage, you said?
Yes, they are always under the age of 20, even though the
They
state
present
law-
an ID that does not have them with the appropriate age, and that's the test that you use?
That is correct. Using their own. They're not fake
Use
IDs.
their own real
Their
Maryland
own real
license that
Maryland
says they're 19
IDs.
or 18. Or
When they turn 20, they are retired from the program, even though the legal age is 21. They cannot lie about their age if they're asked. They have to tell the server their actual age. If the location does sell or serve, either myself or one of the other inspectors goes in, confronts the individual. We do take a photograph of the underage person with the alcohol in their possession. Police officer accompanies us. Police department issues a criminal citation to the server. We issue an administrative citation to the business. The first offense is $1,000. The second offense is $2,500. If there is a third offense, that is a mandatory trip to the liquor board for a hearing before the board. When we do finish up, the servers and the business are given information about the alert class, which they do have to take. The court system has, in most cases, have the servers attend the alert class and perform community service if they have a clean record and they qualify for alternative community service.
Excellent. Thank you very much. Really important program. Dr. Dino, or Mr. Dino.
I'm going to be
Captain Dino.
brief because I'm going to try to do mine in 4 slides. You know where you can find me. If there's any questions you have on it, I'll come talk to you about alcohol or traffic enforcement at any time. Go to the first slide for me. Just a couple positive thoughts. The relationship we have between the police and the DLC and BLC is unique to a lot of places, not only in the state but nationally. I had the benefit working with other traffic enforcement programs nationally. And there's a lot of territorial, them, us. We don't have that. We started doing this many, many years in the early 90s, so we've been trained, so we have that advantage here. We rely heavily on Kathy's ability to do the things that she talked about. They're able to issue, renew, and control the licenses is huge for us. All the programs she does really helps and works to regulate it. Because the thing that's most frustrating for law enforcement agencies is when you have that problem establishment. It takes many, many resources and energy just try to address it. The community gets upset, the police officers get upset, and what I like to say is you can't put the genie in the bottle after it's out. And that's what I think our program has. We prevent these problems. And the last thing, underage drinking is a huge problem in this county. If you hit this next slide for me. So as such, we developed a program, our AIS program, our Alcohol Initiatives, was developed in 1994, and I was very fortunate. I was a sergeant back then, and people listened to me when we had this problem of underage drinking. So we've been working through this since then. The picture you see on the screen, that was the amount of alcohol seized in one prom season task force. So we're talking about 8 weeks from underage drinking parties. So the availability of alcohol at these teen parties just in 8 weeks we got during the prom season, where we're approaching right now, is overwhelming. And that's when we have all these regulations in place, they still have access to alcohol. Just leave it there for right now. When you start looking at the number of DUI arrests we make 3,100 to 3,400 DUI arrests a year. That's a lot. We're second in the state on our efficiency. Unfortunately, when you go to court, the first 2 times, if you don't kill anybody, you don't go to jail. So once again, I'll go over, if we don't regulate it beforehand, our judicial process is not going to save us. Hit the next slide for me. All right. We have a full-time alcohol unit. no one else in the state does. MSP just started a DUI team, but this is a comprehensive team. They do underage drinking. We do a tremendous amount of education in the high schools. We live on the philosophy of education, enforcement, and deterrence to try to prevent these problems. We've been blessed to keep this unit in fashion. They rotate in and out, the officers do. So we're back into a new training cycle. We're trying to get all our programs up to speed. But they coordinate about 200 alcohol enforcement specialists. So although these 6 officers work full-time, we have 200 highly educated officers out there who, when they're during their patrol shifts, they see a business out establishment serving after hours. They know what the laws are because they've been trained by the DLC to take some action. So that although we only do about half the businesses during our compliance checks, we have officers that are paying attention in addition to their regular duties. And the final comment I'll make is, even with all our successes that we've worked with, we have between 25 and 35% of our fatal crashes are alcohol related. So far in 2015, we have 6 crashes, 2 of them are alcohol related. So we're happy that the doctor said we have the lowest amount, but we have too many alcohol related fatal collisions. So my point to you is, we're regulating, we're controlling things, but we in the police department are not ahead of the problem. We know that we're facing, with drug driving, with marijuana coming, that's going to be expanding our resources and our ability to try to keep our citizens safe even more. So I ask, please don't change how we do business now, because it'll make my job a lot harder. Thanks.
Very good. Good panel. I think that, these are all, we've heard many different types of practices that a local government can use to promote public health in the arena of alcohol-related policy. We've heard public safety, licensing, enforcement, the special, the brands that are targeted at kids, the issue of how many stores, affect availability. I think that it's all helpful. We want these programs to continue. I don't think anything that we've really discussed around the issues of craft beer and wine, has an effect on licensing programs or our ability to engage with licensees, or, the police department's focus on prevention or enforcement and things like that. So, I feel that we've been approaching this issue in a very balanced way, trying to model something that, is mindful of public health concerns and doesn't tip the balance. So my colleagues have their lights on, and we'll try to wrap this up after some additional discussion. Thank you. Mr. Leventhal.
Well, first of all, I want to say thanks to all the panelists. I think there was so much good information, but I think the most helpful takeaway is that we have the answer to the pretty substantial number of constituents who approach this philosophically and say that it's just wrong for government to be selling a private product and, being in this marketplace. So there are strong arguments, strong statistics. Dr. Jernigan, I don't think we have your slides. I'd like to get them on the computer. So yeah, if we can have those circulated to every office, because I'd like to refer to those, because we are getting communications from people who just approach this kind of an ideological way, and they don't have to raise their hand and vote to balance the budget every year, so they don't care if we lose 30 million in revenue. They just think it's wrong for government to be in this business, and it's clearly, as I've said earlier, necessary that government is in this business, and there's a spectrum of involvement and regulation. And I've been an elected official now for a good long time, and almost every issue we deal with is on the one hand, on the other hand, and that's clearly the case here. So we appreciate that drinking is part of commerce, and that we want a lively social life, and we want a lively nightlife, and we still want those things, and we want people to go out and have fun in Bethesda, Silver Spring, Wheaton, Rockville, Crown, Germantown, all these communities, but we don't want them to drink and drive, and we don't want them to beat their wives, and so it's on the one hand, on the other hand, and achieving that correct balance, as the chairman said, is the challenge that we face all the time on virtually every public policy issue. Government, we want a government that works. We want a government that achieves results. Too much government is not a good thing. Too much of anything, like our topic today, not a good thing. So how do you find that correct balance? And I think we're moving in the right direction. I did want to emphasize what the chairman said on pricing. And so I do want to delve a little deeper, as the chairman asked. Our stock items may be competitive, our special order items may not be. And, I think it's fairly clear, and I think we're all mostly in agreement as to the direction we want to go, and we want to elaborate on option 4. That's what we've been looking at. I don't think that having private distribution of special order spirits, wines, and beers, and I want to close by asking Dr. Jernigan, if I don't know how much you've been following, Dr. Jernigan, our deliberations here, but in effect, we get a lot of complaints about the special order items. Restaurateurs don't have availability to those unique items that brand the establishment and make connoisseurs feel that they're really living the good life by tasting things that, only they, because of their high degree of refinement, can truly appreciate. Moving in that direction, I don't really see how that would necessarily increase consumption or necessarily increase the social costs. For those who are inclined to appreciate a fine wine or unusual tequila, I don't really see that poses the great risks of dramatically increased policing costs or traffic accidents or that kind of thing.
Yeah, the issue there is the devil's going to be in the details in terms of what's subject to a special order, what kinds of products. Can people special order the products that were referred to that the county is intentionally keeping out of the county? There's also a really good model for how this can be done through a monopoly. It is possible to get special order to work right through a monopoly system, and the classic example here is Sweden. Sweden, when they joined the European Union, they were under huge pressure to get rid of their retail, all of their monopoly, but the retail monopoly in particular. And it went all the way to the European Court of Justice, and the Swedish monopoly was able to make the case not only that they could do this and make it work, but they were actually providing a wider array of access to products than was available in comparable countries that had a private system. So it can be done. I think you have a lot of advantages in keeping it in the hands of your monopoly system, and it's an issue of the justifiable and probably correct pressures on the system to do a better job of what it's doing. But I do think you get some real advantages to being able to say, for instance, absinthe is a great example. Absinthe is, a trendy beverage. It was banned in the country for a century. Well, absinthe, do you really want it in Montgomery County? And
it has arsenic in it, am I right?
Yeah, all sorts of things. But, do you really want it in Montgomery County? Is it going to add that much? And, the reference here, this is an industry that test markets in the neighborhood of 250 new products a year. You want to be able to have reasonable control over how many of those come into your county.
Well, this is a digression. I think the absinthe that is today commercially marketed is not the absinthe that was popular in the 19th century, which had lead and arsenic. I think I'm correct about that.
You are correct in that. It's still got wormwood. It's still made from wormwood. But the larger issue with absinthe is that it's actually stronger than most of the distilled spirits products. And that strength issue is still a question. But I throw it out. There are plenty of other products that we could talk about. Yeah, and while I've got the mic, I want to say one more thing about the sweet spot, because that question came up earlier. And, I think there's a real possibility you're in the sweet spot, in that not everything's going great. You've still got some alcohol-related crashes. You've still got the tragedies happening. And you've got complaints over here that you're doing too much. The pressures are going to continue to be there from both sides. But, man, I look at your statistics compared to the state, and I think something's going right here.
Good. Maybe a field trip to Sweden is in order.
The Swedish monopoly is very happy to host folks from other monopoly systems and do training and all that.
I will skull to that, Mr. Elrich.
I would recommend going in the summer, not the winter.
I would second that. And they don't have spring either. I made the mistake of going what I thought was spring. That was seriously wrong. Um, a couple of comments. First of all, we could deal with the pricing, and I do want to get the data, but at the end of the day, it doesn't solve availability. So unless we can both price it right and make it available, we don't solve that end of the problem. But I'm interested. I mean, part of me doesn't believe you can't do this right, but there is no distributor in the state which has to carry the product line that you would have to carry. No one distributor that you would have to carry here. So I think there are challenges in making that work. I could make it work in a country because you've got lots and lots of market and you can sell everywhere. Making that work in one county may be a bit difficult. That's why we do special orders. But
Absolutely, and the Swedish monopoly does special orders. They do a lot of those. They've got 700 stores for an entire country. Those are the retail stores in Sweden, but they are very, very good at making sure that people can get access to the products that they want to get access to through supplemental things like special order systems.
I will say, when I was there, I never saw so many drunk people walking around the streets at 2 o'clock in the morning. Literally walking around. They weren't driving.
Yep.
But they were literally walking around, falling over, and everything else. I
Well-
mean, I was kind of stunned by that.
Yeah. Culture does trump sometimes our efforts to regulate, but it's a lot of why Sweden and the Nordics have such strong regulatory systems. It's because if they didn't have them, what you saw would be even worse. That's the historical
It's quite
experience.
possibly true. But I want to talk about one thing. I think my takeaway is maybe a little bit different. I think about the nighttime economy. Nighttime economy is essentially an alcohol-fueled economy. It's not about retail stores being open till 1 and 2 in the morning. It's about restaurants and places to drink being open and promoting this kind of endless party atmosphere. Not just the happy hour, because that's not enough of the nighttime. It's like, let's just party on. And you
When I mentioned retailers, I was referring to alcohol retailers.
Yeah. But when we talk about what happens with happy hours and stuff, I mean, it does not strike me that just to say we want this economy because we see other people doing it and look how trendy it is and all the millennials love it is not necessarily the brightest thing to do from a public health perspective. And we've got to figure out how to balance this. I mean, I've always felt that we, on the one hand, were a little bit too restrictive in some of the stuff we did. But the alternative to too restrictive is not a laissez-faire, drink as much as you want, whenever you want. And that seems to me to be a recipe for disaster. I know you think 2 alcohol-related accidents is too, fatal accidents is too many. We're never getting to 0. Because unless you can lock up every parent's liquor cabinet, unless you had to treat those liquor cabinets like you supposed to treat guns, which obviously many people don't do because we get gun-related fatalities in places that have trigger lock requirements. Unless you were to actually make it unavailable to kids, they will find a way to get it. They'll find somebody old enough legally to buy it for them. They'll raid their parents' liquor cabinet. Like, I was a kid once. I mean, there are multiple ways that we all know how this happened. I mean, no sainthood. I mean, I doubt if anybody didn't figure out how to tap into their parents' liquor. So, I don't think you get to 0 because the reality is if you want to do something and you think it's cool and it makes you an adult, you'll probably try to figure out a way to do it. But I do think that our responsibility is to, at least on the things we have the ability to control, to make it as difficult as possible to abuse, to try to be the ones that set lines and set standards and say we don't want to push much beyond this. So as tempting as it is to envision a world full of people partying all the time, I'm also conscious that when the partying ends, that it's a very different story. And I remember I was in Covent Gardens in London, and I stopped in a bar, and they were celebrating soccer, somewhat baffling to me. People were drinking amazing quantities. I mean, people just tilted their head back, and just poured alcohol down their throats. I was like, whoa. I walked back a few hours later, and the place is empty. And I did wonder to myself, where did all these dead drunk people go? Now, London's got an amazing transit system, and in fact, if you get on the tube there, you'll find plenty of those dead drunk people, but not all of them. And it was really quite remarkable. I mean, things I don't even see around here. I mean, I cannot think in my worst days in college going into the grill and watching people just tilting heads back and pouring alcohol straight down to see how fast you could do it. I was, okay. But I hope that we strike a balance. I think it's absolutely critical that we not lose sight of the public health aspects of all this. And so I'm going to continue, and I'm really glad we had this panel. I wish we had more people and more discussion about the public health, because at the end of the day, if all this is about the money, if all it is about, can I do what some other jurisdictions doing, that, then you might want to bring in the statistics for accidents and deaths in other jurisdictions and say, do I want this also? Because I don't believe you get only the good stuff and the fun stuff without getting the other stuff.
Good. Last comment, our own Department of Liquor Control's analysis suggests that that we are losing a lot of sales to surrounding jurisdictions, that people drink as much here in the county as they drink anywhere according to our population statistics, but they buy their alcohol elsewhere. And a lot of our conversation is focused on repatriating sales versus increasing consumption. We're groping in the dark a little bit there, but intuitively, it seems accurate that consumption is what it is, but sales in the county, are lower than consumption, and so that is, has been a key part of this discussion. So I'd like to.
Just that comment, I'm not so sure that that's what the department said. I mean, I think we acknowledge that there are
Well, the
cross-border
PFM
sales.
report said that there is plenty of room to increase sales without increasing consumption if people are buying their alcohol outside the county, which they
Correct.
believe that they are.
But in terms of looking at the comptroller stats on per capita consumption, I mean, I think we acknowledge that they probably do drink more beer in Prince George's than they drink in Montgomery County. And
What does that have to do with anything?
well, that's exactly what we're talking about, was the consumption the consumption levels of comparing jurisdictions.
Okay, but overall, first of all, statistics show that more highly educated communities drink more. And I'm a little,
Yeah.
that's just reality, right? The more highly educated the population in your community,
That's what's
the more money
so-
you have, and then the more you.
But that's what's so remarkable when I found the statistics for how Montgomery County compares on the key alcohol-related health indicators,
Right.
which is why I'm suspicious of the argument that people are just drinking the same, but they're buying from other places. Because if that were the case, I would expect those health indicators to be right around the state average or higher because of the level of income in Montgomery County. And that's not what we're seeing. So people don't, so many of these alcohol control things, they see the inconvenience, but they don't see the protection. And they don't realize that they're actually drinking less. When they are, it's a little bit more inconvenient. They can do a little bit less impulse buying. They have to plan a little more for a party. All of those make everybody else safer. And the image I like to use here is it's kind of like a speed limit.
Yep.
There's there's part of the population that likes to speed, and some of us, when we're in a big rush, we like to speed, but speed limits make everybody safer.
Well, a good analogy here, or response is, we could give all of our beer and wine stores liquor licenses. I don't think that would be a good idea.
Yeah.
I wouldn't want to have 400 liquor stores in this county. But 25, that's pretty low. Perhaps there's plenty of room. The sweet spot has a lot of room in it. That's my takeaway.